Hi everybody, my name is Hannah Adams and I am a fourth year, and today I'm going to talk to you a little bit about how to use the NBME practice exams as an effective resource to study for your shelf exams as well as for step 2. So this video is primarily intended for folks who are either starting your third year and wondering about how to really leverage your limited time to study for shelves, or for people who are maybe at the end of their third year and about to take step 2 and wondering how you can improve on any study strategies that you might have used throughout third year. So if that sounds like you, this is the right place for you to be. So the plan today is really to address 3 different components. So I want to teach you a framework that is going to help you to really effectively use the NBME exams in order to diagnose your own learning. So I want to show you a way that you can think a little bit more deeply and critically about what each question is showing that you do or don't know, and how you can really zoom in on some of those things and spend your time a little bit more in a targeted way in terms of looking things up rather than just reviewing a lot of material that you already know well. The second thing I want to address is how can you use each individual question on a practice exam to find the full range of possible questions that you could be asked about a topic. So each question has one specific thing that it's asking, but there's also a whole lot of other concepts that are tied to that one question. And I'm going to teach you how to identify what those might be and effectively find the answers to those questions so that you are reviewing a little bit more broadly and setting yourself up for success if the question were to be worded slightly differently on the actual exam. And finally, I want to teach you a way of utilizing other resources in order to really go deep on what I was talking about in point 2, which is understanding the full scope of the diagnosis and the treatment. So I think one of the big things to understand about shelf exams and about step 2 exam is that they're really testing your ability to diagnose appropriately, to know when to order more testing versus when to stop ordering tests and treat, and then also knowing the full range of treatment options. Some of the common pitfalls that I see are people either forgetting what the point is where they should stop testing and start treating, or people who really focus on just the first treatment, the first line treatment, and don't really think about what happens if that treatment is not an option or if they've already tried that treatment and it hasn't worked. So I would say those are 2 of the key areas that NBME and USMLE style questions are going to assess. And so that's something that you can know ahead of time and be prepared for. And the LASSI areas that I will cover in this presentation are area 7, which is regarding self-testing, and 9, which is using your academic resources. So here we go. So overall, as you're using an NBME practice exam, I want you to think about trying to review it in terms of concepts and not just questions. And here's what I mean by that. I work with a lot of students in one-on-one tutoring who do a great job of trying to make sure that if they get a question wrong, they understand why they got it wrong and what the right answer was, and the right answer was the right answer, which is a great place to start. But unfortunately, if you do that, you're only teaching yourself the right answer to one specific question. Whereas if you think about the concept and you make sure that you understand the concept in its entirety, you're opening up your scope to be able to get correct answers on any possible question that you could be asked about that topic. So an example is maybe heart failure. So if you get a question about heart failure, you want to make sure that not only do you understand what the right answer was to the question, but also how is heart failure diagnosed? What are some of the key labs that we look for in diagnosing? What are some of the treatment options? And what do we do if the initial treatment options don't work? So thinking about the full progression of the disease and not just one individual question. So at a zoomed out level, these are the things that I'm going to cover. And this is just a broad strokes overview. We'll get into more granular detail in a little bit. But when you're reviewing a practice exam, I want you to think about doing these things. Writing down your diagnoses, making sure you know how to diagnose and treat every single condition you encounter, looking up anything you don't recognize in the question stem. And you have to be really kind of nitpicky about this and granular. And I mean any physical exam finding that you kind of, your eyes glaze over and you're like, I'm not sure how this is significant. Anytime you have that little feeling or that little raised eyebrow as you're reading the question stem, underline that thing and come back to it, because we want to make sure that we're not giving up easy points on an exam because there was something in the question stem that was a gimme and we just didn't notice it or realize what it was. Okay. And then I'm going to also review how to use extra resources to go deeper. And then once you've gained all of this knowledge, how do you remember it? And my suggestion is that you use some form of an active review method. I'll talk about what I use, but I recognize that there are a number of different effective strategies, so I'll discuss a couple of other ones as well. So you're sitting down to actually take a practice exam. What sorts of things do you want to be thinking about? I really encourage everyone that I work with as a tutor to take all of the practice exams timed. Now, in the USMLE exams, you get 90 seconds per question, and that's also true on the shelf exams. So when you take a practice exam, you should use that same time thing. So it's 90 seconds per question, which if you're taking one of the practice shelf exams, equates out to 75 minutes total for the exam. I like to grab a blank sheet of paper, which I have drawn here on the slide, and I like to draw a small box in the upper left-hand corner, which I divide into 3 sections. And then for the rest of the page, I number it 1 through however many questions are on the exam. So usually it'll be 1 through 50 if you're taking a standard shelf practice exam. And I'll explain what I do with each of these things. So I do this before I start the exam. I get my little paper, I set it right next to my computer, and then I grab my glass of water and my timer. I actually use an old school timer. I don't use a phone. Just because I don't want my phone anywhere near me when I'm taking this exam. On the paper itself, in the little rectangular box that you've divided into 3 sections, this box is going to be used it's kind of like how you're going to flag questions as you work through the exam. So I use kind of a 3-tiered flagging system instead of the flag or not flag system, and I find this is a really good way to get the most bang for my buck in a sense of my going back and reviewing questions time. So the top box is going to be questions that you're pretty uncertain of, that you're kind of 50-50, like maybe you've narrowed it down to 2 or 3 answer choices. You generally know the concept, but you really need a good chunk of time to think through this question to feel confident about it. So those numbers, you're going to just write the question number in the box, and if you have time, you'll come back to it. The middle box is going to be questions that you're mostly sure of. It's like 75 to 90%, 95% sure. But there's maybe just like a little bit of doubt in your mind. So these will be the ones that, if you get through the first box at the top and you still have time, you'll come back to these ones. But otherwise, you're pretty sure. And then the very bottom box is going to be stuff you have absolutely no clue about. Like maybe it's asking about a screening test that you've never heard of, or maybe it's a diagnosis that you've never heard of. So these are the questions where no matter how much time you spend reviewing them, it's probably not going to help because you just actually don't know the content. So those numbers you're going to put at the bottom box, and you won't come back to those if you have extra time. You'll come back when you review the exam, but you won't come back during the timed exam period because, at this point, more time is probably not going to be helpful to you, right? So then if you get to the end and you have extra time, you're going to hit the top box first. If you get all the way through there, then you're going to go to the middle box. If you get all the way through there, you're done. Don't second guess things that are in the bottom box unless you've suddenly remembered something that you didn't remember before. And then the numbers, what you're going to do with those is you're going to record what the diagnosis is for each question. So the reason I do this, not every question is going to ask you for the diagnosis. Some of them are going to ask you for treatment. Some of them are going to ask you for screening. So I want you to get in the habit of thinking about what the diagnosis is, even if that's not what the question is asking you for, because when you go back and review, you can check yourself. Did I get the right diagnosis? And that helps you to assess, for the questions you got wrong, was the problem that you didn't know what the diagnosis was, or was the problem that you knew the diagnosis, but you just didn't know the right treatment? So that helps you to direct your studying a little bit more effectively, okay? So this is kind of how I work through the exam. So you're filling out this paper as you go through the exam. Once you get to the end, you're going to take a break. You're going to eat something good. you're going to go do something that's fun and not studying for 30 minutes. So give your brain a chance to cool off and get some food and do something else. The reason that I really push that and recommend that is your review is going to be better if you come to it fresh. Okay, so you're going to be more willing to kind of go and look things up and spend the actual time really reviewing and learning from things, versus if you're really tired and burned out, you're not going to review as effectively. So it's important that you spend the time, give yourself a little break. Okay, once you're ready to review, so you've taken your break, you've come back, you're going to go back to that little sheet of paper that we talked about on the last slide, so this one. And you're going to, as you go through and see what questions you got right or wrong, just also make note of, okay, of the things in the 50% sure box, how many of those did I get right and how many did I get wrong? And same thing for the 75% sure and the totally unsure box. So just kind of keep an idea on like, what's your batting average on each of those three areas? Something that I noticed as I was doing this is that I actually was getting more of those questions right than I thought I would. And I was actually pretty good at telling, okay, which ones am I kind of sure of and which ones am I pretty sure of? So that just helps you to kind of get a sense of your own comfort level and your own ability to self-assess, which is really useful when you come to like real test day. Then the next thing I want you to kind of keep in mind as you're going through the review is, were the missed questions because of the wrong diagnosis, or you had the wrong testing or treatment? So this is why I said, make sure you write down the diagnosis for each question, is this is what that question is going to get at. And then finally, even if the question was only asking you for a diagnosis, so like for instance, maybe the answer to the question was the patient has acute HIV, you should still think about, okay, what would the next step be in this case? Even though the question didn't ask you for that, does this patient need more testing? Do they need treatment right away? What kinds of things would be the next steps, so that in the future, if you get a question where it's the same patient, but instead of asking you what's the likely diagnosis, they ask you what's the most appropriate next step, you know the answer to that question as well. And if there's something that you don't know, look it up. So look things up as you're working through the exam. And then the last thing I want you to pay attention to as you're going through the review was, if there was any physical exam finding or lab test or anything that kind of raised an eyebrow that you circled or underlined as you were working through the exam, this is the time to go back through and look it up. So if there was a physical exam finding where you said, that sounds like a test that they were doing, like one of those MSK tests, because there are a million of them, but I didn't really know what test they were doing, that's when you should go through and look that up. So make sure you know the name of the test and how it's performed and what it tells you. Okay, for physical exam finding, same thing. Make sure you know what is the purpose of this exam finding and what does it tell you? What does it rule in? What does it rule out? Those kinds of things are the things you want to pay attention to. The NBME and the USMLE really are kind of generous in terms of they give you a lot in the physical exam. If they tell you a finding that's not like a standard part of the physical exam, like anything beyond vital signs, anytime they tell you that stuff, it means something. So really scrutinize that and pay attention to it, because you can get a lot of free points just from really knowing the physical exam well. And I think it's an area that a lot of med students understudy. And so you can really get a lot of points from being good at that. A rule of thumb that I love to use when I'm thinking about whether I understand a physical exam finding or a lab test or a procedure is, could I explain this to a patient who had questions? And a good way to test this is actually explain it out loud to yourself while you're studying. So for that reason, maybe it's helpful to be in a room by yourself or in a place where you can speak out loud. Just because, I don't know, sometimes people feel self-conscious about talking in front of other people about something like this, but it is really a good way to check and see if you understand the test or the finding. Can I explain it simply? So now I'm going to go through kind of a 3-tier process of how to review questions, and I'm going to talk about it in terms of 3 types of questions. Questions you got right, questions you got wrong, and then questions that you narrowed down to 2 answer choices and you weren't really sure and you just kind of picked one. So whether you got that right or wrong, really it's the same thing, because you kind of narrowed it down to a 50-50 shot, and either you guessed right or you guessed wrong. But we'll talk about how to review those questions in the context of your studying. So the first one, the easy one, how to review questions that you got correct. So the time you spend on these questions varies depending on how confident you are about the topic. If it's a topic that you really know well, you probably don't need to spend as much time. If it's a topic you're less familiar with, spend a little more time. So the way I recommend, go through all the wrong answer choices, make sure you can explain why each one is wrong. That's pretty standard. But then I would encourage you to go deeper. Make sure that you understand what is the diagnosis based on the vital signs, the physical exam findings, and the patient history. So as you're reading through the question stem, try to pick out all of the little tidbits in there that were pointing to the diagnosis. Kind of tied in with that is this idea of risk factors. So the NBME and USMLE exams really give you a lot in terms of risk factors, particularly for cardiovascular disease. So if you see a patient with diabetes, hypertension, and smoking, that trilogy of risk factors is a really flashing neon warning sign that this patient might have cardiovascular disease. So I would encourage you, as you're reviewing the exams, look back at those risk factors in the patient's medical and social history and think about, okay, was the question writer kind of cluing me towards a specific diagnosis with this history? So a lot of people kind of ignore the history part of the question, but it actually can be really valuable. And over time, you'll kind of build up a bank of, oh, I see these 3 risk factors together. I know it's pointing at this specific diagnosis. So I gave you an example of diabetes, smoking, hypertension being a really good way to think about, okay, this patient, I need to at least consider cardiovascular disease in this patient. I also want to make sure that you think about the pathophys. So for any diagnosis, I don't need you to go into the deeply into the biochemistry unless it's a biochemical disorder. So for instance, congenital adrenal hyperplasia, that would be a time to go into biochemistry a little bit. But for the most part, think about, can I explain the pathophysiology of this disease kind of in broad strokes to a patient, right? So if we're talking about diabetic nephropathy, as an example, kind of the broad strokes explanation of that would be, you have too much sugar in your blood. The sugar is causing damage to the blood vessels supplying the kidney. And so the kidney is getting less blood flow as a result of the diabetes. And that's what's causing the nephropathy. Okay. So again, I didn't get into granular biochemistry detail, but I did broadly explain the pathophys. So make sure you can do that for each diagnosis. And then have an idea of what diagnostic tests are needed. So tests can be kind of a bunch of different categories. The first one is obviously what are the rule in and rule out tests for this disease? But then some diseases you also have to test for severity. So for instance, if I'm diagnosing a patient with HIV, the first test I'm going to get is the combined antibody antigen test, right? That's going to tell me if they have the presence of HIV antigens, usually the P24 antigen, right? After I get that test, though, I'm also going to check a viral load. And what a viral load is a test for how much mRNA of the HIV virus is present in the patient. So that's going to quantify how bad is this HIV infection right now. That's going to give you more information about what your treatment options are. If you have a patient with already diagnosed HIV, you're still going to check an mRNA because that's going to tell you how well they're responding to any medications they're on, but you're probably not going to check a P24 antigen because you already know they have HIV and it's not a useful test. So it's important to think about what is each test actually telling you and whether a test is only used to diagnose or whether a test is used to monitor response to treatment. So those are some things to keep in mind with testing. The other important consideration for testing is any kind of imaging. You always have to balance the ease of ordering the imaging with the diagnostic utility. So x-rays are really great at telling us if something is going wrong with a bone, and they're very fast and they're pretty cheap and they don't have a ton of radiation exposure, so we order a lot of them. However, x-ray is not going to tell you much about nervous tissue or soft tissue. So if you think a patient has a spinal cord injury An x-ray is not really going to tell you anything about that. An MRI would be a much better test, even though it's going to be a lot more expensive and time consuming to get. So it's really important to think about what is the best test in each scenario, and understanding that the same test may be appropriate in one instance and not appropriate in another. And as you're reviewing, you should really try to think about, okay, this was the right imaging in this case. What other option, what other situation would a different kind of imaging be more appropriate? I want you to think about the treatment for each diagnosis as well. So even if the question's only asking you for the diagnosis, I want you to challenge yourself to think about, do I actually know how I would treat this disease? So I think a lot of diseases tend to have similar treatments. So for instance, a lot of inflammatory or autoimmune diseases are treated with steroids. So if you kind of know, okay, the first step for a flare of a bunch of different autoimmune disease, including some inflammatory bowel disease and some of the musculoskeletal autoimmune diseases, we treat flares with steroids for the most part. And then if that doesn't work, or if the flare resolves and the patient needs a long-term therapy, often we use some sort of an immunosuppressant, usually methotrexate or azathioprine or 6-mercaptopurine. So just kind of knowing the treatment tree for each diagnosis, and then being able to kind of group similar diseases together. So I gave the example just now of autoimmune diseases, and thinking about not just for each individual disease what's the treatment, but for this family of similar and related diseases, are there similarities in how we treat? So trying to think about that and kind of build up your treatment tree. And kind of interrelated with that is the next step tree. So next step is a popular question on the shelf exams and on the step 2 exam. It's important to think about next step is sometimes a diagnostic test. Next step is sometimes a medication. Next step is sometimes imaging. Next step is sometimes surgery. And so that's really where your diagnostic acumen comes in, and you have to really think about, okay, do I need more information before I can treat the patient, or do I have enough information and now it's time to start treating? Sometimes treating itself gives you more information. A great analogy of this is if anyone's watched House MD, House does this a lot actually, where he doesn't always get all of the imaging and diagnostic tests. Sometimes he'll just treat the patient and use that as the diagnostic test itself. If they get better, he was right. If they don't get better, he was wrong. So that is often a valid option. And I think the NBME likes to write questions they try to make you pick more testing when actually the answer is treatment. So always kind of keep one eye open in that respect. Think about treatment always as a valid option. And before you pick another test, you have to explain to yourself why you need that test before you start treatment. So always kind of keep that in the back of your mind. And then the last thing, these are the questions that really frustrate people, is, you read the question stem, you'll feel really confident. You'll say, oh, I know what this is. Oh, I know the first treatment, it's amoxicillin. And then you get to the very last line of the question and it says the patient is allergic to amoxicillin. What antibiotic do you want to give them? And you don't know because you only memorized amoxicillin. So always, always, always think about what is the next line treatment if the initial treatment doesn't work or if the patient has an allergy. So it's pretty easy to go through. Once you start to think about with antibiotics and allergies in particular, there's kind of a normal progression that we use where if the patient is allergic to such and such, the next thing we go to is this, and the next thing is this. So it's not too much extra information to look up. And I have seen these questions on the exams, and these are the ones that people get really frustrated by. So you don't have to be one of those people if you always make it a habit of just asking yourself that one extra question while you're studying is, what do I do if this treatment isn't available to me? What's the other option? Okay. All right. So reviewing when you narrowed a question down to 2 choices and reviewing a question you got wrong are similar to what we just talked about, but there's kind of a couple of extra layers that you have to add on. So you should know all of the stuff we talked about just a minute ago in terms of reviewing a question you got right, but you also want to think about how could you have gotten this question right? What information did you need to know to get it right? Okay. So narrowing down to 2, these are probably the most frustrating because you're like almost there or maybe you got it right, but it was just a lucky guess. So this is a great area of improvement where you can really, if you get good at reviewing these questions, you can really improve your score. So what I recommend doing is review the incorrect one first. Make sure that you can explain why was this not the best answer for this particular patient. So a lot of times this will kind of be based on like a screening algorithm or a clinical decision tool. So like a great example would be a patient with a suspected pulmonary embolism. Okay, so you might get a question where clearly the patient, there's reason to suspect the patient has a pulmonary embolism. And so this clinical criteria that we use to decide the next step is the Wells criteria, right? So depending on the patient's risk factors, the Wells criteria either recommends you get a D-dimer or a spiral CT, which is a CT angiography of the pulmonary tree, basically. So if you just memorize spiral CT, PE, there are going to be circumstances where that's wrong because the patient didn't have enough points on the Wells score to merit getting the CT PE or the spiral CT. Whereas if you understand the Wells criteria, you know that you have to have at least 4 points on the Wells score in order to recommend getting that spiral CT. And if it's less than that, then you get a D-dimer. So I don't think you need to necessarily memorize every single one of these clinical tools. There aren't that many of them. So some of the more commonly used ones, like the Wells score, it's helpful to at least know what factors it considers, what goes into it. I don't think you have to be able to calculate it in your head to do well on NBME exams, but you do need to kind of understand, okay, how many of these things does a person need to have in order to bump it up to the level of getting the spiral CT versus, if they don't have enough of them, it's important to know the other test, which is the D-dimer, right? So that's a good example of like how the NBME likes to write questions where they know people are memorizing things and they're trying to trick you into one versus another. So they'll put stuff that's kind of on the borderline, and you have to kind of know, how do I differentiate between these two options? Once you've done the research on that and figured out why it's one and not the other, that's when you're going to make some sort of a review of the concept. And I'll come back to this in a little bit and talk about some strategies for how you're going to review that. But I just want to make the point that this is the kind of information that you really need to jot down somewhere. I like flashcards for this. I use Anki. You can do physical flashcards, or you can do a notebook of some kind. But the important thing, it has to be something that you come back to daily and review regularly, or it won't really help you as much. Finally, reviewing questions that you got wrong. I always, again, like to review the incorrects first before you look at the correct. And the reason I suggest doing this, if you look at the correct first, it's easy to tell yourself the story of, oh yes, I understand this now. But I think that you actually get a much deeper understanding and a deeper picture of the true concept when you look through the incorrect answers first and you go back and read through the STEM and see, okay, these are the things that was missing from the STEM that I would have expected to see if it was answer A. So it kind of helps you to pick out what I call the pertinent negatives, right? So the hard thing about NBMEs is they give you the pertinent positives, but they don't give you the pertinent negatives. Negatives are like the empty space, and you have to be thinking about what's not there. And if something is not in the question STEM, that is also a clue. And that's a skill that you have to develop. And I think the best way to develop it is reviewing the incorrect choices and going back through the question STEM and looking for those things and saying, oh, okay, well, yeah, I can see why this wasn't congestive heart failure because they didn't mention anything about pedal edema or shortness of breath or orthopnea in the question STEM. So those are your pertinent negatives in my example here. After you've done that, then you look at the correct answer. Also go back and review in the question STEM what things in the STEM say this is the best answer. And then it's really important, once you've figured out what's the right answer, why were the wrong answers wrong, figure out why you got the question wrong. So I've encouraged a lot of students I've worked with to do this, and I see a lot of times people actually misattribute the cause. A lot of times students think that they didn't know the answer. They think it was a knowledge gap, when actually it wasn't. It was either they knew the answer, but they thought that was too simple and straightforward, and so it had to be something else, and they overthought it, and they picked something that was wrong despite actually knowing the answer. So I call that overthinking. Sometimes students misread the question. So, maybe you're reading fast because you're crunched for time and you skip over one part of the physical exam, and that was the key finding that you needed. So, if you missed a key symptom, it wasn't really a knowledge gap, because if you'd had that key symptom, you would have gotten the question right. So the reason I really encourage people to pinpoint these causes is the treatment is really different, right? If you had a knowledge gap, you need to go back and review that content. But if you just misread the question because you were going too fast, you don't need to review the content. You just need to read slower and make sure that you really go back and look for certain things in the physical exam and the HPI. So I like tracking these mistakes over time, because that really helps you to pinpoint what is actually going on. So specific things to pay attention to. These are kind of some of the top hits that I've seen in NBME style questions and exams. So these are the things that they love to do. These are the questions that a lot of students get wrong. If you can be aware of these things and learn these findings, you're going to get a lot of points that other people are going to miss. So one of the big ones is compare and contrast findings. So by this, I mean, sometimes you'll have two diseases that present very, very similarly. So an example is post-infectious glomerulonephritis and IgA nephropathy. Both can present very, very similarly, but there are a couple of key findings that can tell you it's one and not the other. So for instance, PSGN or PIGN presents later. Usually it's like 10 to 21 days, versus IgA nephropathy presents much earlier. And then PSGN involves complement, and IgA usually does not. So if you know these key points, I call those the compare and contrast findings. So those are things that help you to differentiate between two really similar conditions that might have similar symptoms. These are the kind of things that make great flashcards. And when you do a flashcard for these, make sure it includes both diseases. And I'll give you an example of this later on. Another thing that really is a great and highly testable concept is the sensitivity and specificity of tests. So the way you'll see this in a question is they will give you what seems like a slam dunk diagnosis question. And then you'll be like, oh, I am sure I know the answer to this. And you'll get to the very end and there will be a test that addresses the diagnosis you're sure it is, and that test will be negative. And so you have to know, okay, is this test sensitive enough that a negative is meaningful, or could it still be this diagnosis even with the negative test? So knowing the sensitivity and specificity of tests helps you to, when you get a question stem that has a test result in it, to analyze that effectively. Will it change the management is a great question to ask yourself when you get those next step questions. So when you get a question, you figured out the diagnosis, it's asking you for the next step in management. You have to decide, should I order a lab, should I order imaging, or should I start treatment? A great rule of thumb for labs and imaging is asking, will it change the management? If we think a patient has a meniscal tear, an MRI is going to be the best imaging to show that, but an MRI is not going to change the management of that meniscal tear. So we usually do not order it until the patient has had symptoms that don't resolve for 6 to 8 weeks. So in this case, that will it change the management question helps you to decide, should I get the MRI or should I treat? And in my example, the answer is treat. Don't get the MRI yet. The other thing to pay attention to, I've already addressed this a little bit, but situations where a clinical score or a calculator may help. So these are like the things you'd go to MD Calcs for. A few of the really common ones that come up is the ASCVD risk calculator, the CURB 65 score, which is for pneumonia, the Wells criteria, and the Wells score, which is for DVT and PE. So make sure that you understand these really commonly used. Anytime you're in the wards and your resident brings up a test like this, or they say, oh, well, the Wells score was such and such, or the Curb 65 was such and such, or the there's one for COPD, the GOLD criteria, the GOLD score. Look up these things when you encounter them in the hospital, and you don't have to memorize them, but definitely understand what situations they're appropriate and what they can tell you in terms of management. Another great example that I see tested a lot is the Centaur score, which is for strep throat. Basically an algorithm for should you treat and test or should you not? And it's also important to know when these criteria apply and when they don't. So for instance, the Centaur score is only validated in adults. So in pediatric patients, it's not useful. And I have seen this tested on the NBME exams before, where they'll go after, they'll give you a pediatric patient and you'll calculate the Centaur score, but you'll forget that that score isn't validated in children. So the treatment algorithm is different. So pay attention to the limitations as well. And then finally, I talked about this already as well, but pay attention to disease patterns. So things that present similarly and are treated similarly. So a great example is cancers. For the most part, any solid organ cancer, we treat and diagnose somewhat similarly. So by that I mean, usually we need a tissue diagnosis, we need imaging, and then the treatment options include surgery, radiation, and or chemo. Now, the exact order of those depends on how bad the cancer is, but generally we have to first prove it's cancer, which is the tissue diagnosis. We have to get imaging to see exactly where it is. So usually that's a CT or an MRI. And then we decide based on those two things, is this something that we can cure surgically? Is this something that we're going to do surgery and then we're going to do radiation chemo? Or is this so advanced that surgery is not really an effective option, and so we're only going to treat it with radiation and chemo? So paying attention to those patterns can help you where when you get a question where you don't know the exact answer, but you understand the general theory of similar diagnoses, you can usually reason your way to the right answer, even if it's not something you've specifically encountered before. Generally speaking, as you're reviewing, if you get to the point where, okay, I've reviewed the exam, I know what I got right and wrong, I know how to diagnose this condition, but I don't really understand the complete workup or treatment of this condition, that's when you go to your resource. I think UpToDate is great for this because it goes in the same exact order as what you'll want to know. So it first goes, how do I diagnose? And then it goes, how do I treat? And then it kind of goes through special considerations. And it's going to have links to all of these scores and criteria as well. So it's a really great resource. For things that are a little more pathophysiology or biochemistry nitty-gritty, PubMed is a great resource. It's a little less readable than UpToDate, but you can find a lot of great information there. And then for specific things, there are other great resources. Step Up to Medicine is a really great overview of the treatment for most of the commonly encountered medicine complaints. Harrison's is kind of the resident level textbook for IM. It's a great resource, but it's a little denser than Step Up to Medicine. And then, of course, DiVirgilio's for surgery. And then really utilize, I think a lot of people underutilize the professional society guidelines that are published. These are free, and you can just Google them. So this includes the ACOG guidelines, which are the OBGYN guidelines, and that's about like recommended prenatal testing and the algorithms for like preterm labor and who gets what and all of these very specific OBGYN things. That's a great resource. The U.S. Preventive Services Task Force, if you know that there's like 150 A and B recommendations for the U.S. PSTF, it's not that many. You can easily make them into a pretty small flashcard deck and just make sure you really know them cold, and that'll get you basically every single screening question correct on the exam. And then the final thing is the CDC vaccine schedules. So these are really great for any of the medicine and pediatric clerkships. So peds, definitely, vaccines are a big deal, but also family medicine, internal medicine, and also OBGYN, because that matters a lot as well. So make sure you understand the CDC vaccine schedules. Again, this is something that you can easily just go on the website, print off a PDF, or just save a PDF to your computer, and then make sure you understand the concepts. It takes you maybe a day or two to review each of these things, And if you continuously review it, come back to it every couple of days, you won't lose it. And you'll get a lot of questions right, kind of freebies, right? So what do you do once you have figured out, once you've done all of this review, you've gotten all the way through the exam, you've looked up all of these things, you understand how to diagnose, when to get imaging, when to treat, when to do surgery? How do you remember all of that? So I'm a big fan. This is one of these adult learning theory things where we've done a lot of research on how adults learn and how it's different than how kids learn. One of the things that we know is you're going to remember better if you do active recall. So what is active recall? Well, the best way to understand active recall is to compare it with passive recall. So passive recall would be things like reading a textbook, watching a video, reading and highlighting notes. So anything where you're just ingesting information, but you're not being forced to respond to questions or give the answers without reading them yourself. Anything where you do have to respond to a question or think through something or formulate a response, that is an active recall method. And that has been shown to be a much more effective way to long-term remember these things. So I've given a few examples of ways that you can do this. Like I said, I prefer Anki. I would advise against just relying on an Anki deck that somebody else has made. I think you can definitely use that resource, but you should always view it as a living document, and you should adjust and edit and add cards to it based on your own personal individual needs. And if a card doesn't make sense to you, you should feel free to edit it until it does, until you can really make sure that every time you see this card in your deck, it's going to remind you of the fact that you need to know to get this information right in the future. Another option is keeping like a running question and answer style document. So I've seen people do like a Google Doc where they have like a table. It's like a 2-column table, and one column will be the question and the other column will be the answer. And they cover up the answer. They ask themselves the question, and then they can kind of go through that way. So that's another way to do it. You can always have somebody quiz you. Helpful if that person understands the content. So great if you have a med student roommate who can quiz you and you can quiz them. If you don't have that, sometimes you can Zoom somebody, or sometimes even a lay person. Depends on kind of what you're doing, but that can be a great way to do it too. And then another thing that I really love is busting out your colored pencils and your art skills and making some sort of a compare and contrast graphic to differentiate between similar diseases. So an example of this would be, I remember making like a 3-circle Venn diagram to differentiate between the torch infections. So between like toxoplasmosis and CMV and some of the other torch infections, just to make sure I understood where does it overlap and what are the things that differentiate between these things. I do want to spend just a moment kind of drilling down on how to really use flashcards effectively. So these are a few examples of flashcards that I have personally made to go after some of the specific things I mentioned earlier. So up in the upper right-hand corner here, this is the front and the back of a card that I made. I talked about this a little bit earlier, but this is about differentiating between two really similar diagnoses, so IgA nephropathy and post-streptococcal glomerulonephritis. So you can see this card is going after the differences in the complement. And so I forced myself to review what I call the whole fact. So not just IgA doesn't activate complement, but making sure I differentiate IgA doesn't, but PSGN does. And then on the back side of the card, which you can see here, I also go through why. Okay, so IgA, because it doesn't activate IgG or IgM, doesn't activate complement, because we know that complement is mediated by IgG and IgM. But PSGN does activate IgG and IgM, and that's why it activates complement. So making sure you understand and have a way to quickly review the pathophys, that's going to really give you a lot more bang for your buck than just a card that said, IgA glomerulonephritis does not activate complement. Like, okay, that's technically correct, but it's not as complete. This next card down here, so just below the IgA and PSGN card, this is something I was talking about before with paying attention to the sensitivity and specificity of tests. So this card presents a patient who has what looks like a slam dunk case of Staph aureus septic arthritis, except for the gram stain is negative. We would expect a gram stain to be positive in a patient with Staph aureus. This is the answer card, of course, so you can see the answer is in fact Staph aureus, and then here is the reason why. Because even though we have a negative gram stain, the gram stain here is very unsensitive. It's only 17% sensitive, which means that 83% of the time, patients do have Staph aureus despite having a negative gram stain. So it's a low sensitivity test, and that's an important thing to know, because what that's telling you is the fact that this gram stain is negative is irrelevant. If the rest of the question stem is pointing towards that Staph aureus infection, that's the right answer. The bottom corner here, this is an example of making a card to help you understand something that's in the question stem. So in this case, it's a test. I would always come across these titers in questions, and I will admit that I, for far too long, didn't actually look up and really understand what a titer was. Until finally I was studying for step 2, and I was like, I probably should actually figure out what a titer is and how to understand them. And so I went and looked it up, and then I made a flashcard about it. So basically it's showing you, it's asking you to apply the information by giving you, which is higher, 1 to 8 or 1 to 32, and then it tells you why. Okay, so I always like a question that makes you apply the information, and then you have the info on the back of the card rather than just putting this part on the front of the card. I think it's more helpful to kind of do that two-level thing, because you're going to actually have to apply the information on the exam, so you should practice doing that. And then finally, over on the left side here, this is a front and the back of a card. This is, again, like differentiating between two similar disorders, but in this case, I used imaging findings. So with imaging on NBMEs, you have to be careful, because sometimes they will describe it and use what people call the buzzwords, but sometimes they will not, or sometimes they will give you the image. So it's important to both know how is it typically described, but also what does the image look like, and how do you differentiate it from something similar? So in this case, I'm differentiating between osteosarcoma and Ewing sarcoma, and I'm giving how would each of these things be described, and then what would the picture look like of an x-ray for each of these two things. So kind of putting all of that information together in one place, where when you're reviewing, you're not just reviewing piecemeal and doing like one tiny piece of the puzzle, but you're looking at the whole puzzle, because that's going to help you organize the information inside your brain. We talked about patterns already. So generally speaking, there are certain kind of steps that we go through. A great example that I love to give is the surgery kind of progression of thought, which is first see a patient on surgery, we want to know stable or unstable, right? If they're unstable, they're going to the OR right away. If they're stable, we're going to keep working up. So if they're stable, are we getting imaging, or are we going to just do testing and watch them? And then are we going to end up taking them to the OR, or are we going to try managing medically first? Okay, so a great example of one of the kind of general patterns. So it doesn't really matter what the complaint is for surgery. That's kind of the order of operations regardless. I talked about the cancer diagnosis already. So again, that's a great example of a general pattern. And then I also mentioned imaging before. So imaging, again, has a lot of great general patterns. Usually we do the fastest thing first, but there are certain modalities that kind of trump x-ray depending on what the patient's presenting with. So a great example would be a patient comes in with head trauma and altered mental status. That patient is going to get a head CT before we do anything else. So even though x-ray is the fastest and the lowest radiation, if we're worried about a brain bleed, we need a head CT, and it needs to be a non-contrast CT so we can see if there's a bleed, right? So it's important to know the general order of imaging, but then also what are the circumstances where we would do something else first, okay? So paying attention to the patterns there will help you out a lot. And then we talked about this a little bit already. As you're reviewing each exam, you want to make sure you go through and keep a log of why you got each question wrong. So I've created a little document that I use, which is what's pictured here, where you're identifying the specific topic that was wrong, and then the system, and then why did you get it wrong. So I really like this document because it doesn't take long to complete. You can do it in about 10 seconds per question, but it also helps you to go through later and say, oh, I'm getting a lot of cardiology questions wrong. I think I need to go back and spend a little bit more time reviewing these specific diagnoses within cardiology. Or maybe you say, oh, I'm getting a lot of questions wrong because I'm overthinking. So I think I'm going to try on my next practice exam just going with my very first gut instinct and see how I do. So keeping track of these things can help you to prioritize. Shouldn't spend a lot of time on this though. It shouldn't take over your life. It should be a very quick document. It shouldn't be something that you spend a lot of time on. And then you got to make sure you come back to it, right? If you just fill it out and never look at it again, that's not serving you. You got to be able to make sure you come back to it and actually analyze and adjust what you're doing based on what you're seeing. So I hope that has helped you a little bit with some of the study strategies for NBME. NBME exams can be a really great tool, but you want to make sure that you're giving yourself enough time to use them effectively and that you're really taking advantage of all of the possible learning opportunities that exist within all of them.